Hi, Lauren. I too agree that the difference between the duty to protect children and the right to freely practice his or her own religion must be considered. If these differences are not considered, patients' safety is ultimately put at risk, which we have seen in numerous case studies. While adults have the right to medically decline treatment due to religious beliefs, this does not apply for children's medical care if medical treatment can prevent harm or death from the child. In two case studies, 2 lives could have been saved from medical treatment. 2 children lost their lives from untreated diabetes. Family members chose to pray for their child in lieu of medical treatment. I think it is important to note that religious beliefs do play an important role in an individual's healthcare experience. Patients having some type of faith or spirituality can help them grieve, understand, and have hope in their medical diagnosis, which is important for patients to keep with them to provide that hope, because I do think that hope is a critically important thing when receiving healthcare. Patients are encouraged to continue practicing their beliefs. However, if these religious beliefs become a barrier to critical medical treatment for children, then intervention is required by the healthcare disciplinary team from a legal standpoint. You discussed how nurses have the obligation to do no harm, and I completely agree with that standpoint. And as nurses, it is important that they are advocating for their patients, especially among the pediatric population, because these patients cannot legally make their own decisions for medical treatment. So I think it is extremely important that as nurses we are aware of this difference between the duty to protect children and the right to freely practice their own religion, and do what we can to ensure the safety of our patients and put them on the right path through effective communication and intervening when possible.